Today is the 17th of September 2020, 3:30 p.m. This is a 25-year-old radius slider.
Female. They came in for what? What reason?
Came in for the swollen neck.
The swollen neck. Let's show the swollen neck. Okay. Now you can see that the neck actually has a wound, a very noticeable wound. Two wounds. One is further up towards the neck, and then the one further down. So now these wounds are very common because this female red-eared slider is housed with another one in a small tank. The other one is a male, and the tank put inside. The tank is about this size, I believe. So the male is keep on. This is the male. The male keep on trying to attack the female due to, I presume, lack of space or territorial behavior. And I think the female probably got fed up, and since the male attacked the female by jumping on top of her, I think the female probably should use the claws to protect herself and cause scratch and damage or traumatize or wounded this male. And you can see there's one here below. That one is the usual place where they get injured, and there's another one further up. Now the owner has been treating this for ringworm, thinking that it's ringworm, and the other vets didn't want to treat this red-eared slider till she searched the internet and came to Papaya Vets. Okay, now we put this red-eared slider on the floor and see whether she can walk or not, whether she's active or not. You can tell a normal one will walk, well, at least move. You see this one is moving, but not very much, but at least she's moving, so that is a good sign. Okay, then upside down, whether she can turn upright or not. So this is the second pair. Now a normal one will turn upright within about 1 minute. 1 minute they turn upright, and this one is trying to. This is good. She's having this swelling for last 3 to 4 months actually, so it comes and goes on and off, so it will be due to infections. But okay, let me see from this side. She has no energy, so she can't really turn. So this shows that this red-eared slider is very weak, so it can't turn, and it's also very thin. What's the weight?
1.1 kg.
We turn it back first, turn back onto the. At least she can walk, hopefully. Now, the differential diagnosis is whether the neck swelling is due to fluid retention from kidney or liver disorders or heart disorder, or due to infections. Now you look at the legs, you pull out the legs. Is this swollen? The paws. You check the paws. Is there any swelling? Put on the floor so that we can focus. Is this swollen? See the back one? You can feel it. Swollen, you can feel it's puffy.
It's a bit puffy.
A bit,
Yes.
Especially near the toes, near the toe.
Yeah.
The front one. Oh, you really got to press it. Any fluid in it. Any fluid?
The front one is fine. Front is fine.
The other front. Just press it now.
It's okay.
Then the back one, near towards the toe there. Any swelling on the toe area? That doesn't look like it to me.
Yeah,
Oh, okay, turn it up. So we can conclude that this one is unlikely to be fluid retention due to disease of the liver, kidney, or heart. Okay, so we can come to a safe conclusion that this is a neck abscess, which has not responded to the antifungal treatment of the owner. Okay, now we put into the tank and put water in to check whether the red-eared slider is swimming lopsided or not. You can't tell until you fill up the water. Okay, fill up. Good. need a lot of water, as you can see. So that we can see whether she's floating well or not. Now to feed the red ear slider, normally you should put it in a tank now, full of water, so that she can swim. Not just a bit of water, and hope that she will just eat it from the water. The only thing that you have to use more water because this is a very big one, a big slider. Can you swim? Yeah, you can move a bit. Is it swimming lopsided?
Yes.
Doesn't. But I would say the water is still not enough. Just go and, okay, now we will just throw the 5 only. We start with 2 also can. 2 pellets. You don't need to put 20 or what. Just in front of the nose. In front of the nose. See whether she ignore it or not. Yep, she just ignore it. She just drink some water, I can see. And whether it's swimming lopsided or not, it's hard to tell. But it looks like a bit lopsided on the right. You can see that sometimes they have respiratory disease, and by this test you can tell. Okay, not interested in the pellets. Bypass it. Okay, get some water, more water quickly. It seems to be a bit lopsided on the one side. We put more water and see. From here we will tell whether he had respiratory tract infection. Now after that I will try and lance abscess. Oh, I think it's cracked already. No, wait. I think this container is cracked. Let me it's cracked.
Can add a bit more though.
Okay. Better don't reach to the top now. Is it swimming lopsided? No, it looks okay. Throw another 2 pellets in front of the nose. We don't throw a lot because it's hard to tell. No, just in front of the nose, just in front. Oh, is it eating? About two. Some interest. You see, that's why you need more water, otherwise they can't eat. They just throw it on a half fill, they can't eat. Okay, there's some appetite, but you won't be interested. Okay, another one. So to feed the red ear slider, you have to fill the tub with full of water, rather than just put a bit of water and throw the pellets in. That is not what they usually do. I mean, the red ear slider swims and eats. And let's see this one. Of course, you can eat 20 to 40 is even better. But the thing is that we can't put too many in, because if we put too many in, then we don't know whether she eats or not. Okay, 2 more in. 2 by 2 in front of the nose. In fact, if she eats better still, we don't do syringe feed. But syringe feeding has its advantages because it encourages more food intake, and also the vitamins and minerals. I think that's about how many she ate? 3.
She's been 4. She ate 4.
4. Okay, put 2 more in front. Okay. Of course, it would be better if we can let her eat 20, then we don't have the syringe feed. But I don't think she does it. And this one you have really got to be very patient and very and feel the tank with water. Otherwise, you will find that it just doesn't feel like eating. Okay, and you fill it with water so that it swims. It likes to swim and drink water at the same time. So that's good. Put 2 more towards the nose, to your left side. 2 more. Don't put so many. Okay, I shall stop now. So this shows that there is appetite.